Thank you very much, Dr. Karen. I would like to run you through a presentation on building HR in Zambia. Apparently, at the moment, my position is National Coordinator Rehabilitative Services. In the first slide, I attempted to explain what rehabilitation is. I'm sure we are all aware what rehabilitation is all about. These are some of the terminologies and what explains what rehabilitation is. A set of measures that assist individuals with experience or are likely to experience disability to achieve and maintain optimal functioning in interaction with their environments. This is from the World Report on Disability, a planned process through which disabled persons can partially or fully restore their physical, mental, sensory, or social vocational function abilities. It's from Sampa 2002. What are the specialties or components in rehabilitation in Zambia? We have physiotherapy, prosthetics and orthotics, occupational therapy, speech therapy, and audiology. The current situation. We have an overarching national policy in place which has amalgamated all existing policies in the health sector. We don't have specific sectoral policies. They have been captured under the national health policy. And rehabilitative services is a component within this national policy with the objective of providing comprehensive medical rehabilitative services at all levels of care. Measures strengthen and expand provision of medical rehabilitative services, and this is what we have concentrated on. Yep. Current situation continued. The focus of the Ministry of Health has been improving the entire continuum of care, and rehabilitative services this time around is given the equal attention that the establishment is not very impressive. We only have 500 physiotherapists, 19 prosthetic volunteers, and 1 each in these specialties. We haven't started training yet in prosthetics and audiology, speech therapy. So there are huge gaps in those areas. Our strengths. There is very good political will. That is the major strength. And then we have more rehabilitation professionals recruited in the system. Very recently, the government employed over 7,000 health professionals, which included rehabilitation workers in all specialties. But of course, with an exception of the audiologists and speech therapists. Support towards procurement of equipment and consumables. There's massive support towards that. And we are lucky that we still have a number of institutions offering training in some rehab specialties, like physiotherapists. We have courses at the university, at BSc level, and diploma level. We have well-equipped P&O therapy and physiotherapy units at tertiary and second level institutions. As for P&O, the P&O centers, they are fully equipped to the standard that now they are going to be used at educational centers in the country. Physiotherapy services are available at health center level to tertiary institutions. The weaknesses, of course, the challenge, you have seen the numbers on the establishment. We have inadequate human resource, inadequate infrastructure, and lack of positions on the establishment for officers who are upgrading. Then the non-availability of training institutions, for instance, in P&O, occupational therapy, and these other two disciplines. And lack of support towards refresher courses. Opportunities. I've again mentioned political will as an opportunity, because we can influence policymakers when it comes to training issues, and they are receptive on that issue. Partnerships with organizations such as Orthotists, who have come on board in Zambia to work with us. ICRC Movability Foundation, they are partnering with the Ministry of Health in trying to come up with training. Then the threats, of course, are inadequate funded position, poor conditions of service, which will, of course, bring the attrition both internal and external. And this is very, very common. You find that if people are not happy, they migrate. Others, they change profession. They go into something else. And this is happening. Building human resource and skilled professionals. What are we doing? Physiotherapy. We are lucky that we still have institutions. They are training at BSc level. Then the master's training is in progress. And what is required now is to build on PhD development. Then prosthetics and orthotics, occupational therapy. We are in the process of establishing training schools in Zambia. Though I can ask them to mention that for occupational therapy, I think they are starting training this year at a private university. And then speech therapists and audiologists. This is the biggest challenge, because these people have to be trained abroad. Though 2 weeks ago, I learned that we have a school in audiology, which is being run by the American people. It's a private institution, and they are getting people from the region to train in audiology. How do we move? We need to work with public and private universities in operationalizing this aspect, and partnerships with organizations such as Orthotics, CBM, GIZ, ICRC, and others who would like to come on board. Then the Ministry of Health recently came up with one strategy to try to enhance training in the health sector. We have a very massive infrastructure which is coming up in Lusaka, which will have a capacity of 3,000 students being run by the Ministry of Health, besides the universities that are training other rehab professionals. The idea behind this Center of Excellence is that areas with gaps in human resource will be considered. And for instance, I pick nursing. They want to train nurses. They may say, maybe we take 1,000 nurses that go. They train and offload onto the market, and maybe that way trying to reduce on the gap. If it is physiotherapy, they may say maybe probably, besides what is happening in the other universities and other colleges, they say we train 500 physiotherapists, offload after maybe 3 years or 4 years, just like that. P&O, I know it may be a challenge. It cannot be sustainable because you need a lot of equipment. So we just have to follow the other route, which is to train according to other schools in, for instance, here in South Africa, the Durban University, Walter Sisulu, and Swane University of Technology, and TATCOT in Tanzania. Then I think this will try to sort of mitigate the challenge of HR, and they are thinking of operationalizing this training through the public-private partnership model. And then there's the issue of skills mix. We need this continuous professional development. We are in discussion again with Orthotics, where they will be inviting us to come and train here in South Africa or run short courses within Zambia to sort of up the skills. What is in the National Health Strategic Plan? We are envisaging to train about 400 physiotherapists in the next 5 years, train 30 prosthetists, orthotists, or orthopedic technologists, 30 occupational therapists, at least 20 speech therapists, and 20 audiologists. Justification for training. Disease burden. You know, in the previous presentation, NCDs has been coming out strongly. With the exponential rise in NCDs, we all know what leads to NCDs. It's a challenge everywhere. And very soon in Zambia, this may supplant trauma, going by the numbers of people who are coming with amputations related to NCDs. Population growth. We are not stagnant in terms of population, we are growing. So that is equally a challenge and a justification. Shortage of qualified professionals. That equally cannot be overemphasized. You've seen the numbers. Then again, we should look at the capacity to employ. The government cannot absorb everyone. So they will train for the government itself as well as the private sector. Then we have to look at sustainability plan. How are we going to retain the professionals that we are going to absorb in the system? Market survey. All these are issues that have been raised. Then I delved in the clinical practice, where we need to establish rehabilitation service delivery model and strategies. We are working with Dr. Banda here from the University of Zambia to come up with a rehabilitation service delivery model and strategies for the health sector. Then focus will be on preventive and promotional interventions. This is now the in thing, and we have mentioned the NCDs. We really need to check the lifestyles. So the focus of the ministry now is on preventive and promotional interventions before the curative or treatment aspect comes into being, or the rehabilitation part. Infrastructure development and equipment. The need is there to develop infrastructure for rehab services. Then we need to procure equipment for service delivery. Already the ministry has invested about $679,000 US towards procurement of P&O equipment, and about $8,000 US in physiotherapy equipment in the past 3 years. We cannot run away from the PP mode. In terms of infrastructure development, we need to have partnerships with other organizations. And of course, this should move in tandem with training. In conclusion, I said that training of rehabilitation professionals is key to realizing comprehensive service provision to people in need, as well as achieving the ultimate goal of providing an individual with the best possible opportunity for full and effective participation and inclusion in society. Thank you very much.